Okay, good. Welcome to the Half Hour to Help. Okay, tonight we're going to talk about bladder and bowel control, but we're not really. Okay, because you got to look at it. You can't really isolate functions of how the body works. And that's one of the reasons that we're having a problem in the medical world, is because they do isolate it. It doesn't work that way. And you got to figure everybody has it. Now, is that the ultimate example of a man? Yes, Clint Eastwood. Oh, dude, I love the guy. Well, when we look at this, we got to look at the anatomy and physiology of this. Everything's connected. You can't separate it. Now, the nervous system controls and coordinates every function of the body. Does that mean it coordinates the kidneys that dump fluid into the bladder? Yes or yes? It does. And then when you look at this, there's two muscles inside of there. In fact, you don't have pain sensors inside of the bladder. You might say, no, I'm telling you, my bladder's hurt before. No, that's pressure sensors, okay? Now, the nerves that come out of the base of the sacrum here actually control the bladder function. Now, when we look at this, there's two different human beings on the planet. Now, we actually have an x-ray machine that has male, female, and other. I haven't seen the other yet. But this, when we look at male, we got to look at, we're going to look at both, but look at how the system is laid out. I mean, you got to figure you got a bladder up here, and this bladder goes through an organ called the prostate. Now, the prostate is actually right in front of the rectum. So every time a stool, a healthy stool, goes by that prostate, it massages it. Now, 80% of all American men over 50 are going to have a prostate problem. This is because our diet and we're being poisoned. However, if you look at this, the only group of men on the planet that don't have a prostate issue are Buddhist monks. And the reason is they're vegetarian, but they also do prostate massage where you actually massage it. So healthy bowel function, healthy prostate function is essential for healthy bladder function. Okay, does that make sense? And then when we look at this, the bladder in women, if you see that it's right in front of the uterus, so this is why when this uterus expands, like during pregnancy, how many women have been pregnant in here? Okay, oh, I gotta go, you go in there, an ounce comes out. Gosh, I felt so much fuller than that, okay? You know, that's because you could put pressure on the bladder here, but also it's prone to more infections too. Plus, particularly in women, if this uterus expands to hold a kid, it's going to put more pressure on the pelvic area. So we want to start looking at mechanical structures in that. Now the pelvis, this is the most beautiful thing you've ever seen. It supports the entire body. This means all your organs are sitting inside of this virtual cup. Now on the floor of this is the pelvic muscles, the girdle muscles. Okay, now this is super important. In fact, Russell, can I borrow you as a demonstration? Sure. Come on up here, stand right here so you can be filmed. Okay, now I'm going to demonstrate his muscles. So now, if a muscle is stretched out, is it strong or weak? Don't answer. Okay, good. Now, right now, his muscle is stretched. So these fibers inside of here, they're actin and myosin filaments. They're very, very far. There's not much of them attached. Okay, so now try and bend your arm. He can't do it, and I'm holding him with very little pressure. Okay? Now, what I'm going to do, I'm going to shorten that muscle. Okay? So now the muscle, there's more fibers attached. Okay, now bend it. Okay, he can actually pull me over. So that means, thank you, very good job. Okay, thank you, Russell, you did a good job. Okay, so what he's demonstrating is that if more of those fibers are connected, that it's muscle stronger. This is important because when you look at the muscles on the bottom of this, if they're stretched out because the pelvic floor is bad or there have been multiple pregnancies, those muscles are going to be weak. So when you cough or sneeze or laugh, a little bit of urine can leak out. So now we have to look at the stability of the pelvis and the strength of the muscles. Does that make sense so far? Okay. Now, this is a poisoning of America, of human beings. The Fraud and Deception Association is actually approving food that's poisonous to our body. And in fact, we're living in a calorie-rich, nutrition-poor environment. So what happens is, when you take in this calorie-rich food that you can't break down, you're going to store it. That's how human beings are. So now, remember that pelvic girdle's in here. So do you think that there's more pressure on that area? Absolutely. And plus too, when you sit on the bones of that pelvic floor. In fact, you know how you say, I hurt my butt bone? You actually sit on this bone here called the ischial tube. Now, if you sit on that bone and there's a lot of pressure, what happens is those butt bones actually separate, or they open up that pelvis. So this means the more weight that you have coming down, is going to separate that pelvis more. Does that make more sense? Also, if you're sitting more, it's going to have more weight. So everything goes into that pelvis and how much pressure is on it. So this is huge. Then you look at the structures around it. Sitting is one of the worst things to do. But now we want to strengthen the pelvis. Does that make sense? So now let's say you have a job where you are sitting. The best the best seat that you can have. You know how you go to Staples or Office Max, you see these like $5,000 ergonomic chairs that have perfect back support and everything. They're worthless. Well, actually not. They're worth $5,000. Okay, but they're not effective for biomechanics. See, what happens, you have no genetic defense against sitting. What sitting does is it actually pinches the nerves in the low back that supply that pelvic area. This is why the nerves that actually supply the bladder and pelvis come out of the base of the spine. So sitting pinches those nerves. You don't feel it because the sensory nerves are in the back. And when you sit, the sensory nerves you don't feel. But it's the nerves that supply the organs that are compressed. So they came up with the idea of a ball chair. And it's one of the cheapest chairs around. It costs around $70 or $80. But what happens is, remember, sitting on those bones, those sit bones, you're always constantly moving just a little bit. Not much, but you're moving your pelvis just slightly if you're sitting on that ball. And that allows you to sit with less damage, not discomfort, damage. Sitting is actually damaging your spine, nervous system, and the pelvic girdle. So that's what's deadly. Now, when we look at this, we also have to look at, so we got a mechanical problem of sitting pinching the nerves. We got a mechanical problem of that pelvis opening up. We got a mechanical problem of the muscles that are stretched out. Okay, so we got multiple mechanical problems. We now got to look at what's filling the bladder. Okay, and this is the kidney filters. The filters are amazing, but you can't look at the kidney filters. We got to look at the blood that the kidneys are filtering. Okay, so can you start to see this? So when you go to the urologist, he's going to send you to the hematologist, the blood expert. And then he's going to send you to the endocrinologist because there's going to be a problem with the blood. So our system is segmented into all of these specialist groups when the body doesn't work that way. You can't talk about the health of the bladder without talking about the health of the kidneys. You can't talk about the health of the kidneys without talking about the health of the blood. You can't talk about the health of the blood until you talk about digestion. Okay, so everything's all tied in. Now, in normal red blood cells, they should be separate. And this is a live blood cell analysis, and if the blood cells are separate, they work right. Now, you figure this kidney, it's the size of your fist. It filters every liter of your blood every 20 minutes. So it does it 24 hours, 7 days a week. So in order to do that, there's very, very small arteries in there that are only 1 cell thick. So they have to filter those blood. Now, has anyone heard of the deadliest poison in America? It's by the CDC. It's called acetaminophen. You might know it has Tylenol. You've heard of Tylenol?
Yeah.
Okay, well that, along with other drugs, and the other drugs are called non-steroidal anti-inflammatories, they inhibit prostaglandin production where they clump blood vessels together. Now, this is crazy because there's no way in the world that these chemicals should be on the market and marketed to human beings. Because by inhibiting prostaglandins, it clumps blood vessels together. Now, if it clumps blood vessels together and these blood vessels have to go through a kidney, do you think it might damage the kidneys?
Oh.
Yes or yes?
Oh, yeah.
Yeah, all you got to do is read the label. It says may cause kidney damage. What's it doing on the market? If it damages the organs, it shouldn't be in there. And so here's one, the non-steroidal anti-inflammatories, and this is out of the Journal of the American Medical Association. Now, it's interesting because it says that these drugs damage cartilage. Now, why is Advil, Motrin, Tylenol, ibuprofen, why are those drugs prescribed for joint Pain. Hi, take this drug, but it's going to destroy your joints. You'll feel better though. So when we look at this, because we got to go back to the health of the blood. Now, you've got an artery that comes down. That artery gives up oxygen and nutrients, and then 90% of it flows back into the vein and then flows up. So 10% of the blood fluid that flows down, and this is blood that's constantly flowing, is the lymph fluid. Now, the lymph is vital. This is like the sewer system of the body. Has anyone ever heard of lymph nodes?
Yeah.
Okay, lymph nodes, they used to take them out in certain cases of cancer. Now they found out, oh my gosh, can anyone do a good Homer? Oh, okay. They go in there, they find out, oh my gosh, these things, they actually kill cancer cells. So you have to leave the lymph nodes in now. So they've done it, they've corrected about a 40-year mistake. They're starting to leave lymph nodes in. And one of the first people is Dr. Lorraine Day. When they wanted to take her lymph nodes out because they were swollen up the size of the walnuts, she said, no, they're swollen because they're working. I'm fighting a disease and they're helping me. So when you look at this, the health of the blood is going to go into the health of the lymph system and the health of the lymph fluid. And this all goes back because that lymph fluid eventually filters in through the blood and then back to the kidneys. Now, the functional unit of the kidney is called the nephron. And this is the most brilliant thing you've ever seen. In fact, it's a collection of a whole bunch of little tiny small blood vessels. And there are thousands and thousands of these. Remember, your kidney is this big. It has multiple little tiny units in there that are microscopic. They're only 1 cell thick. You cannot see it with the naked eye. Now these nephrons, they actually, fluid flows out and fluid flows back. So guess what happens to most diuretics? It causes more fluid to flow out and less to flow back. So this is why diuretics dehydrate you. A lot of drugs that get in there can damage that nephron. Now what happens is this nephron is so small, diuretics, non-steroidal anti-inflammatories, poisonous food, they can damage that. Now if you damage the nephron, it inflames, and then that's called nephritis. They're easily plugged. Now, and this is why also, have you ever heard of diabetics have high kidney damage rates or kidney problems? You ever heard that before? That's because their blood's thick. And in fact, the way they used to diagnose diabetes is the doctor would taste the blood and it would say, that's sweet. Then some doctors got grossed out by that. Then they would actually have dogs taste it. And if the dog said, you know, hey, master, this is really sweet, that's how you would diagnose blood sugar problems. I don't know if the dog really said that, but you know, he probably said, yeah, this is good blood, this is bad blood. Okay. But when you go into this, you start looking at this, the blood sugar now. When we talk about diabetes next month, you're going to find out that the ignorance, see, type 2 diabetes is 95% of all diabetics. And what they do is they give you a drug to force your blood sugar down low. And they do work, metformin, glucophage. So 95% of all diabetics take a drug and they lower it. The problem is insulin levels remain high. Insulin, along with glucose, damage the kidneys. So here are these people, they're taking this drug and they're checking their thing and they're thinking, wow, it looks like I'm okay. The insulin levels remain high. So this is why any type 2 diabetic that's taken the drugs is going to die early until they correct the problem. And we're going to talk about how to correct diabetes next month. Now, this is another thing, because anything that damages the kidneys is going to damage the bladder function. Okay, does that make sense? So now, back row, I want you to read the bottom line. No, I know, that's cool. Okay, yeah, break out the opera glasses. Okay, so I put this is a list of medications that are inappropriate for seniors. Does that make them okay for kids? No. Does that make them okay for regular people? No. Okay, I'm actually over 50, so I qualify for AARP. I'm a senior, baby. Okay. So you don't need that stuff. What I want you to do is start looking at this. The reason we're having bladder problems is because we have poisonous blood. We have poisonous blood. The reason we have poisonous blood is because of food choices or medication. That's it. That's it. and this is the litropropyl or antacids. See, this causes a lack of iron being absorbed, a lack of calcium being absorbed. This is why hearts don't work right, so you get cardiac palpitations. The blood actually gets poisonous. This one here is demonstrating how blood pressure medications. It turns out slowing the heart down slows oxygen to the entire system. That's why I also put on here which number is important. Some people will ask, what is a good blood pressure number? I don't know. What activity are you doing? What's your diet been like? What are your arteries? Are they clean or clogged? Well, my doctor doesn't ask me those questions. Well, your doctor's an idiot then. Okay? He's not going into this stuff. He has to understand that blood pressures vary throughout the day. They're going to be affected. If you have clogged arteries, by gosh, that blood pressure has to go up. If your arteries are clean, the blood pressure is going to go down. Okay, now what I want you to do, does anyone want, you want high blood pressure or low blood pressure? Which would you like?
Okay.
You want high blood pressure? Good. You want low blood pressure?
No,
Okay, good. Go to sleep. Okay. You want high blood pressure? Okay, good. You want better mental function? Okay. So you got to start to see, you don't want high or low. It depends on it. If you want low blood pressure, do me a favor. Sit up nice and straight. Take a deep breath in. Blow it out. Another one. Deep breath in. Blow it out. So you just hyperventilated. What you did is you lowered your level of carbon dioxide. You have a sensor in your neck that actually sensed that lower level of carbon dioxide, and it slowed the heart down. Just deep breathe and slowed the heart down, lower blood pressure. You want to raise it? Hold your breath for a little while. Isn't that interesting? So now it's foolish to chemically regulate the blood pressure. I mean, this even says if you chemically regulate it, you may die an early death from heart disease, cancer, or diabetes. And again, that damages the kidneys. Daily aspirin. Daily aspirin, and again, this is completely unscientific advice. And if I have one more nurse that says, well, it's a difference of opinion. You know, I'm raised in a school where we practice medicine, okay? Okay. I practice science. What's the leading cause of kidney disease? Aspirin. What's the fourth deadliest drug in America? Aspirin. What drug has shown no benefit for cardiovascular things? What they prescribe it? Aspirin. What has no science behind it? Aspirin. Okay? What increases risk of stroke and GI bleeding? Aspirin. And you're telling me you prescribe aspirin? Geez, you know, go out and sacrifice a calf. That'll be more scientific. Okay, so can you see this? I'm tired of lemmings jumping off. Sheeple do not inhabit our planet. You do not go along with this stuff. I mean, this is poisonous food. Nobody should be eating this. It's going to thicken up blood. Then we got celiac disease. See, your body, and this negatively affects the kidneys, it negatively affects the bladder, it negatively affects how your body's working. So why are people all of a sudden allergic to wheat, barley, everything else? Do you want to know why? Wheat and barley and all the glutens out there have changed. Since 1996, these genetically modified proteins have been on there, and all allergies is a body's abnormal recognition of protein, so this is causing a massive rise in celiac disease. When you look at this, if you want to look at the fun stuff, look at Medline, okay, for solutions for celiac disease, and they say there's no treatment for it, surgery, and steroids. You look at the natural websites, they always say, oh yeah, it can be treated and cured within about 30 days. Okay, if you have an infected arm, you can treat that arm by cutting it off. Okay, does that work? Yeah, of course it works. I mean, you know, it doesn't make any sense. Let's work within the natural parameters of the body. If you take poisonous food, you're going to inflame your intestinal tract. That's going to poison the blood. Okay, does that make sense? So if you do have bladder problems, you got to eliminate the proteins that may be causing the poisoning of the blood, that may be causing the kidney damage, that may be causing the bladder. Can you see it tying in now? So this means you've got to go on a gluten-free, casein-free diet. 180 liters of blood a day. These kidneys are amazing. So if to have healthy kidney function, you've got to have healthy blood. It's incredible. I mean, you got to figure it's the filter. It's the blood filter. And since we're exposing our body to poisonous food, it's going to negatively affect it. So what's the number one thing that you can do to have healthy bladder and kidney function?
Fruits and vegetables.
Can I borrow this? Here, watch this. Can I break this?
Oh, sure.
This is vegetable juice. She went to a machine that put vegetables in one end and gave a soluble fiber. This is antioxidants. This is bioflavonoids. This is soluble fiber. This will actually lower blood pressure and clean arteries. Wow. She's smart. Thank you. Great demo. That was fantastic. But I mean, think of it, because all of these fibers, and this is nature's pharmacy. There's over 10,000 bioactive enzymes in tomatoes. We know blueberries lower cholesterol, but they lower it because there's multiple phytonutrients in there. These phytonutrients actually have developed antifungal and anti-cancer properties over the centuries. We don't know how they work because science is not going to investigate it. We just know they do work. Now, what is a normal bladder function? Well, first off, usually, and this is normal, 3 hours or more. That's when your bladder should be active. If you're doing it every hour, that means you have a hyperactive bladder. Okay, so now it should be 0 to 1 time a night. If you're getting up every couple of nights, it means you have an ineffective bladder function. And I'm going to show you how to correct that. And when you go, there should be about 1 to 2 cups of urine. So this means between 8 and 16 ounces of urine. If you're going and there's just a little trickle, that's not enough. Okay, now what we want to do is understand what an overactive bladder. So if you're going multiple times a night, if you have to go multiple times, even once an hour, that's not effective. So now let's look at how to desensitize the bladder. Because remember, your bladder only sends a message up to the brain when it's supposed to be full. And this is one of the reasons that enuresis or bedwetting is so effectively treated with chiropractic. Because now here in bedwetting, you've got a bladder. When it starts to get full, this is always sending signals up to the brain to say, hey, look, my bladder's getting full, get ready to void. My bladder's getting really full, get ready to void. Oh, holy, we don't have a chance to wait. Pull over to the side of the road, Dad, find a bush. Okay. Raise your hand if you've been there. Yeah, okay. Okay, so what happens in kids is they don't know because there's a thing called threshold firing of the nervous system. And if those nerves are pinched, that nerve has to be firing rapidly in order for the brain to send it. So they think they don't feel it. Oh, okay. So what we've got to do now is what we do in treating bedwetting is adjust the pelvic system and then the brain can communicate to it. What you might also want to do is to desensitize it, and this is huge. Now remember, in a male, the bladder right next to the prostate, right? So if that bladder continually develops pressure, is it going to put pressure on the structures around it? Yes or yes? Yeah, it has to. So if a guy continually holds the bladder, like let's say a truck driver, let's say you're a teacher, let's say something, you're going to end up with more prostate problems because that's going to increase the pressure of all the structures around it. But now let's say when you're voiding it too fast. Okay, and when you void, there's not a lot of fluid. So you want to reset the sensor. You want to hit the reset button. Okay, and this is how you reset the button. You realize every time you urinate, you're urinating, say, more frequent than you should. When you urinate, you're only urinating out less than half a cup, okay, a very small amount. So you want to reset the signals in there. So when it's really, really full, you got to do the Kegel. Okay, now the Kegel is totally different. It's not the funky chicken, okay? It's not the chicken dance for Oktoberfest. But you got to look at this. Incontinence, because this is huge, you got to look at this first. Hypersensitivity, it means during urination, there should be about a 6 to 8 second flow. So this means 1001, 1002, 1003, 1004, 1005, 1006. That's a normal flow. If it's 2 seconds, that's too much. Kids, teachers, truckers, weak pelvic floor, and drug-induced. Those are the main causes. This is ridiculous, okay? I actually saw a surgical option. Surgical option. So what they do is, now the nervous system controls every function of the body or every function of the body?
Right.
Yeah? Okay, good. So what do you think? Okay, I don't know how much you have to drink or smoke to come up with this idea, but instead of sending the patient over to a chiropractor to get the pelvic floor checked, let's just put an electronic device inside of the spine to override the natural signals of the bladder. I mean, okay, so this is the last one. That's the sacral stimulator, and that's just mind-boggling. When we start looking at this, the things that can affect it, obviously caffeine's a diuretic, alcohol again. It's interesting that sweating, your body detoxes through 4 different things: respiration, perspiration, poop, and peep. Okay, so if your body is toxic, you're going to want to produce more urine. So more urine could be a sign of excess toxicity. Why do we talk about poison blood? Because if you're urinating a lot, your body's trying to eliminate a lot of toxins. Does that make sense? Yes or yes? High blood pressure drugs, breathing. How do we lower blood pressure? That lowered blood pressure. But also, you got to figure your kidneys, if pressure is too high, your kidneys are actually going to get rid of more fluid. So if your pressure is high because you're not breathing enough, you're going to start filling up that bladder and you're going to be voiding it more. Does that make sense? Oh my gosh, this is great. It's tied into blood health, food health, nutrition, digestion. Wow, isn't that cool? I know. You got to walk by a mirror and smile. Now this is the Kegel. Okay, you put your left foot in, no, okay, that's the hokey pokey. No, the Kegel is totally different. Okay, now this is hard to do, but you can do it just sitting down where you are. I'm going to do it standing. Okay?
Can we have a handout of it?
No. I'm going to tell you right now how to do it. Okay, so what you do, and you can practice this on the toilet, when you're urinating, stop the flow in midstream. So now where you're sitting, stop the flow. Okay, imagine. So what you're doing when you're stopping the flow, exactly, and that's just what you should be doing. I'm going to demonstrate what you should be sitting. Okay, ready? 1, 2, 3. 1, 2, 3. Did you see that? I moved. Okay, I'm doing the Kegel right. Okay, do the Kegel. Okay, so what you do is your body should tighten up just a little bit, because what's happening is, remember that pelvic girdle, that floor? When you tighten it up, you're squeezing the sit bones in together. Okay, is that cool or what? Now this is also how you reset, good job, how you reset the bladder. When it's full, you want to do the Kegel. Now at first, you're going to want to leak out a little urine, because if that bladder's full and you do the Kegel, you're increasing pressure on the bladder. Okay, so be conservative when you're doing this, but what's neat is, remember, there's no pain sensors in the bladder, there's only pressure sensors. This is like the reset button on that, and you'll see it. I'm so excited for you, because like if you urinate every hour, you want to increase the pressure there, and then you'll find out, hey, I don't have the urge anymore. That's cool. But also, look for salt. Look for minerals, because if you're mineral deficient, particularly if you're urinating a lot, you're going to be urinating out a lot of minerals. So you want to increase salt in your food. Sea salt, healthy salt, Celtic sea salt, Himalayan sea salt, because what that'll do, that'll increase the salt in your blood and in your body, and it will also help you retain water, and you'll produce less urine. Okay, does that make sense? So if you've had bladder frequency, reset the bladder, increase salt, okay, and get your nervous system checked. Because everything reverts back to the nervous system. It really does. Once the nervous system is checked, you've had a good, healthy diet, you've cleaned your blood, and you've increased salt, and then you've increased your volume, then you've got normal, healthy function. Now a lot of people have been exposed to poisoning or antibiotics. They're poisonous molds, and they're going to have multiple kidney or bladder infections. Now, why would you have multiple bladder infections? Let's go back again. Poisonous food that leaks into the bloodstream. The bloodstream is actually poisonous. This goes to the kidneys. That weakens the kidneys. That goes to the bladder. That goes to the bladder. That leads to infections. So, what's solution by Dumb and Dumber? We give a poisonous mold that you take into the bloodstream, that you take into the kidneys. It's like, come on, guys, you can't be serious. It's like, how do you treat antibiotic-resistant bugs? You give them more antibiotics. Seriously, I know. It's like, you know, the Three Stooges took over the medical world. High-dose vitamin C is fantastic. So you have multiple bacterial infections or multiple courses of antibiotics, high-dose vitamin C is fantastic. Linus Pauling would do 10 to 20,000 units a day. Now, what's interesting about this is vitamin C is a water-soluble vitamin, so if you take too much, you're just going to urinate it out. That's it. That's it. You're just going to urinate it out. And so that is actually very good for bladders because you're increasing the oxygen in there. Also, D-mannose. Now, D-mannose is a type of sugar that's fantastic for bladder infections. There's healthy sugars out there. High fructose corn syrup is not. That's a poisonous sugar. Grapeseed extract and olive leaf extract, garlic and onions, coconut oil, antimicrobial. There's so many things that you can do that are actual antimicrobials. Now this, I don't think I put that on the sheet. No, I got everything else though. Also, so antimicrobials, if you've had multiple bladder issues, you're going to have multiple bladder functions, and what that can do, multiple bladder infections can actually scar the ureters and urethras. So this means that the fluid coming into the bladder and the fluid coming out to the bladder, the tubes that hold the fluid, can be damaged. And if they're damaged and inflamed, you're going to have an inconsistent bladder function. Does that make sense? So inconsistent bladder function, we have to make sure that it's clean. You might say, well, I don't have an infection. If you did and you took an antibiotic for it, you got a problem. So this, inundating your body with soluble fibers, great move, miss, okay, and antimicrobials will actually help clean the ureters and clean the urethra and get healthy function. Does that make sense? Good. This gal here, her name was Debbie. 13 medications. So were her kidneys working really hard?
Oh, yeah.
Yeah, 13 drugs. Okay, there's no science that says that you should use 2 drugs, but she was taking handfuls of 13 drugs. Now I told her, I said, separate the drugs by at least an hour. Okay, why? Because that would lessen the toxic effect. Does that make sense? I said, drink a full glass of water in between. She said, Doc, I can't. There's not enough hours in the day. You know, I got to take them in the morning, take them in the evening. Handfuls of it. Office worker. She was about 50 pounds overweight. She had a poor diet. You know, she was stopped by, got the bagel on the way to work. Okay. She had the sandwiches or went out with the girls for lunch. She didn't really exercise a lot. I mean, so what was her kidneys like? What was her blood system like? You know, what's her nerves like? You know, obviously. What's amazing is within 90 days, okay, not only did she lose 40 pounds, okay, but she actually went down, no medications, and she all of a sudden regained her bladder function. Does that make sense? Does that sound neat? Yeah, it's almost like respecting the way the body is. This is for healthy bladder function. It's also just for healthy function. You need to get your nervous system checked first. Exercise, and this is one of the best ways to stabilize that pelvis. See, if you're walking, you're moving the lymph. If you're walking, you're moving that pelvic floor just a little bit. If you're breathing heavy, you're also strengthening the muscles of that pelvic floor, and that will help get more control. So is walking essential for healthy bladder function? Yes or yes? Absolutely. Proper nutrition. This means absolutely 100% organic, 80% raw, and healthy nutrition. And if you do have a bladder issue, you've got to up the supplements of the vitamin C, the water-soluble, the antimicrobials, just to heal the ureters and urethras. Sufficient rest. If you aren't sleeping at night, your body is going to become toxic, because at nighttime, that's when your body builds cells. If your body's toxic, the kidney's got to work hard. If the kidney's got to work hard, the kidneys get damaged, and then that negatively affects the bladder. Isn't it cool? Can you start seeing it? Can you start seeing the pattern, how one system's connected to the other system? God, humans are cool. And then prayer and meditation. That's why I said God, humans are cool. They're built by God. We gotta pray and meditate every day to help with cell growth. It really does work. Now, this is the summertime, so we do have coupons up there, but to get checked is vital. Okay, you got to get your nervous system checked, and that's so important. That's where it all starts. But I got to thank you so much for making it tonight, because to take time out of your day to learn, because the TV will tell you this stuff, right?
Yeah.
No. Eventually it will. Eventually Oprah's going to see this. Eventually we're going to get on the big networks, okay, because this is revolutionary information. It's going to be tough because I'm not a big fan of narcotics and pharmaceutical products, because they do damage. But with your help, we're going to make a difference.